You might not recognize this gentleman. Rossi is an eminent sociologist, professor at Harvard, and later Johns Hopkins. He's a prodigious scholar in the field of evaluating social programs. He's written over 40 books, 200 or so papers. In fact, his textbook on the subject, Evaluation and Systematic Approach, to this day remains a classic in its field. He died in 2006, but in his time he was advisor to more than one president and also to the US Senate. Now, lately, Professor Rossi's name started cropping up a lot in the context of social benefit bonds or social impact bonds. And it's always citing him. He's what he called as Rossi's metallic rules, his laws of evaluation. I only put a couple here, there are several of these. The better designed the impact assessment of a social program, the more likely is the resulting estimate of net impact to be zero. That's the stainless steel law of evaluation. The next one, this is called the zinc law of evaluation. Only those programs that are likely to fail are evaluated. Now, when you see that, at first blush, it sounds like he's dumping on social programs, and it's quite depressing for those of us who are working in that space to read that. However, I don't think that's the correct characterization of Rossi. He's championed many social programs. It's just that he has this old-fashioned notion that programs must meet their intended outcomes. And his real point about these laws of evaluation was that a rigorous evaluation system, a measurement system, will always cut through any amount of data to expose a program, a social program, that is not achieving its outcomes. Now, when you listen to that, the obvious question that comes to mind then is that, can you then come up with a measurement system that will more likely than not help you achieve outcomes? Now, when you think about that, a corollary to that would be, even if a program goes off track in the early days, can a good measurement system inform you so that you get up to good corrective actions and put the program back on track? Now, these are the questions I wanted to grapple with in my presentation. Now, of course, we're going to talk about designing outcomes, the risks and opportunities, and those subheadings there, but you'll see two key themes running through this presentation. The first, how do we structure a measurement system that more consistently and predictably likely to produce the outcomes you want? That's the first key theme. The second one is our own experience at GEO in putting this theory into practice. And I'll tell you a little bit about GEO in a minute. And I want to share with you the learnings that we've had, both when it's worked and when it didn't work, and how we were able to put that program back on track. Now, effectiveness in social programs, of course, has been talked about a lot lately, and I think the context is very clear. I mean, we covered it this morning as well. But I want to take it a little bit higher and say, well, perhaps if you look at it at a global scale, we have got the global financial crisis to thank for this. Because the structural shifts and financing restructuring that took place in country after country when public coffers said, we've run out of money. The revenue base is shrinking. The core programs in health and homeland security is taking up a lot of the funds, and that's crowding out funds for social programs. So if you are in the market as a provider, relying on funds from public purse, there are lots of eyes on you to see whether you're being effective. Now, so there is a new emerging context, and we talked about it this morning, within governments, to have these outcome-based contracts. And that's broader than just the social impact bonds or social benefit bonds. Now, in that context, David Brooks, not that long ago in the New York Times op-ed piece, wrote a very interesting article called The New Normal. And here I think is the money quote. The required deficit cutting nationally will hurt, but it also provides an opportunity for programs to be tested for effectiveness. So the new normal, which David Brooks called effectiveness revolution, sort of had sort of predictable things. He was arguing that it would be outcome focused, there would be more pay for performance, there would have to be the right metrics, and of course innovation, There would have to be faster proof of concepts. People are impatient to wait even for 5 years. I think David touched on that earlier. New funds, they wanted new funds to come into it. And of course there has to be this risk transfer from taxpayer to provider because taxpayers have simply run out of money. That was the argument. Now, that new normal, interestingly enough, in the space that we work, in corrections, is not so new. Because outsourcing and paying for performance has been part of this scene for quite some time, even in Australia. Now, GEO has been part of this for some 20 years. Now, if you look at very quickly about us, we run the Arthur Gorrie Correctional Centre in Queensland. It's the largest maximum security remand centre. It's a very busy prison, over 24,000 prisoner movements every year. And it's really at the pointy end, in the beginning end of the prison system. That's where prisoners come into the correction system. Now, if we go right the way down into Victoria, we run Fulham Correctional Centre, which is at the other end of the prison spectrum, in that is a prison that actually releases prisoners out into the community. In fact, Fulham Correctional Centre releases more prisoners into the community than any other prison in Victoria. And that's a campus-style prison, and it provides more of the pre-release programs. In New South Wales, there are 2 prisons operated privately for contract with the government, and that's Junee Correctional Centre since the early 90s, and Parklea Correctional Centre. Junee Correctional Centre first is really 3 prisons in one. It's a prison that has the remand prisoners, it also has sentenced prisoners, and it also has prisoners who will go out on work release. Then Parklea is unusual in another fashion, and that is all these other prisons, and generally in the world, prisons have been outsourced when they were built. In other words, from day one of the prison's life, it was outsourced. Whereas Parklea, on the other hand, was the only prison that was to change hands from public to private, midstream, so to speak. One day it was being managed by the public sector, the next day we went in and took over the running of that prison. Now Parklea also is a kind of 3 prisons in one. It's got remand centre, Western Sydney, of course, and then we've got there's a small work release unit as well, and we also have a therapeutic program where therapeutic programs are delivered to violent offenders and sex offenders. So you can see there's an awful lot of variety in the type of prisons we do. Now, just very quickly, if I run through the history in corrections, some of these arguments have gone through very predictable lines, and it's interesting to see how it unfolded. Early contracts generally were highly prescriptive processes, and input driven. I'm going to exaggerate the point just to make the point a little bit, exaggerate the impact. There were, for instance, the contract might say, thou shalt have so many unit officers in a particular unit, or thou shalt open the prison door thus. It would be as prescriptive as that. But that changed very quickly, and then indexation came in as a means of improving productivity. That is to say that the government would say every year, if your contract revenue, contract fee is not going to be uplifted by the normal price index or labor price or CPI, it'll be going up less a percent. So that means if you're going to keep up with the market, you had to find productivity improvements. So that was a measure of trying to get performance through the back door. Then they came in through the front door and said there will be fees will be put at risk. If you don't achieve a particular target, you will lose certain fees. So a certain amount of your fees will be kept in trust, and it will only be paid back to you when you meet the targets. Or there will be penalties for poor performance. Then there was also positively pay for performance. Actual performance bonuses if you were to achieve better than best practice. Now, the interesting thing there is that in that particular state, what happens is that if you produce the best outcome in 1 year, the following year you have to improve that performance. So if you've got a 5-year contract, on the 5th year, your lungs are bursting when you're trying fast to beat yourself. Then there's, of course, reward for innovation. There was actual funds paid out for any innovative practices. Now, how did we respond within GEO in that 20-year period? The first, of course, we had to come up with efficiency dividend to the taxpayer, because that then became the measure by which we were measured in terms of value for money. There were productivity improvements, there was focus on outcomes and better risk management, and innovation and faster proof of concept. Now, the faster, I think somebody raised the point about the low-hanging fruit, and that's very important in the corrections field, Because I know this morning we've been talking about the three important stakeholders here, the government, the financiers, and the providers. There is another fourth group as well, and that's the target population we're all trying to help. They're not lab rats, so can't make them wait 5 years for results. You can get it faster, we'd rather get it faster. So it's important to get the low-hanging fruit, even though it might be thought of as being something that's easy. It's not. And also the other point about innovation is that generally governments ask for innovation. Innovation has become one of these sexy terms now. Everywhere, innovation is always tagged on at the end. And particularly in corrections, there are no fantastic innovation. You know how in the James Bond films you always have a scene where Bond goes and sees Q, and takes him to the basement and shows up all these little mobile phones and launches a nuclear missile or whatever. There are no such things in corrections. In fact, yesterday at lunch, David mentioned the point. It's about getting the little things right. It's about getting the small things right. It's about becoming effective. It's about producing the results consistently. That really is the innovation. The other part is that better metrics and monitoring and assurance. That obviously goes without saying, because obviously we're going to have perfect performance. There's going to be lots of people looking at your performance. So we've got partnerships. We realized fairly quickly in the process that we can't do it all by ourselves. I think Hillary Clinton wrote a book about, it takes a village to bring up a child. Well, it certainly takes a village to reduce recidivism for prisoners as well. And we need a group of collaborators that work with us. We call it the Coalition of the Willing, to come and help us to get this job done. And of course, the social benefit bond pilot, which we're participating with Mission Australia and Social Finance. Now, of course, it hasn't been smooth sailing. There were risks. One of the risks, of course, if you're trying to not have the risk passed on to the taxpayers, that means you have to find savings on every little program that you invest in, because you're actually putting your own money at risk in a correctional company. So we had to get the fundings for the programs that fail from the programs that succeed. So if you try 10 different things, if 4 fail, the 6 would have to pay for themselves and for the other 4. The next point, of course, is the interventions with high net benefits. So obviously, we have to look for those low-hanging fruit because of that critical limiting factor. The treatment population had to be defined clearly up front. Our team realized fairly early on in the piece, if you don't do that right, the interventions are likely to fail. The other point, of course, is a credible impact assessment and measurable impact assessment. That goes without saying. The faster result and proof of concept I've already mentioned. Now, the key theme that runs through all of this is our own reputational risk, and therefore the correct risk assessment for us was trying to get the measurement system right. So what did we do on that? We had the Impact Assessment Challenge. The acronym there stands for measuring what matters most. And we realized fairly early on that we had to get 3 things right. First, the metrics. Now, anybody working in this space, if you say to them, we're going to have a measurement system, you'll hear groans, because we've got data coming out of our ears, as providers, because all kinds of people ask for data. And it's understandable, they all have different interests in the data, but it's not a lack of data the issue in measurement system, it's about the right measurement system is the issue, the right metrics, which is focused on outcomes. That's going to take a lot of doing to come up with that. And it's often glossed over sometimes, but this is a critical issue for us. The next issue then, if you're going to get the right measurement outcomes, right measurement for the outcomes, the issue then is the mission, trying to clarify the mission. Now, I picked a couple of these. I just went into the internet, picked up a couple of large worldwide organizations who are doing really good work, charitable organization. Here's the mission statement, and it's highly inspiring. However, if you take the first one, to eliminate, this is on a worldwide basis, by the way, to eliminate poverty and its causes. Measure that in 1 year. The next one, affirm the dignity and worth of families living in poor communities. How will we measure that? So we had to go through this. You'll see what the learning that GEO had to go through on this similar sort of issue. Measuring what matters most. The other thing is that there's an awful lot of emphasis on impact measures. We found that there's 2 other categories also we had to pay attention to. First, the capability measures. It's so easy to forget that there needs to be the capability to reproduce a result. If you don't measure that soundly as you go through the program, you're bound to fail. Because impact measurement and pay for performance. It's not like a big bang, you don't wait for 1 year later to see whether the thing goes off. Because we have to see, obviously, during the course, corrections have to be made. So we have to measure capability. This is to do with infrastructure, it's to do with resources. The second one is operational measures. This is about, are we doing getting the processes right? Are we doing the right activities? Those are the sorts of things that we have to look at. Then, of course, the impact measures, you know about that. Now, here I just picked up one example. This is at Juni Correctional Centre. Now, this was done entirely by our frontline staff. I'm fortunate to have the Offender Services Manager, Trevor Coles, here. It's he and his team put this together. I'll just quickly run through how, in the microcosm of one prison, how things worked in about trying to produce performance. We also had this very inspiring slogan, GEO builds better lives. Now, effectively what that was about was that we were given prisoners in custody, entrusted to us. We obviously our team wanted to produce better lives for them. But we also wanted to produce better lives for the community into which they're going to be released, because all the prisoners that we have, sooner or later, they're going to get out. So we wanted to make sure that they and the community within which they're going to be released are going to be better off. But our team had to think about, how are we going to get that working? So they got the 7 pathways, of course, but then they picked up 7 things that they had to get that right. So in family matters, what are the things we're going to do? So we picked up issues on, as I think Trevor put it very well the other day to me. He said, we had to realize that before we release the prisoners into the community, we had to release them into their families first. So that sharpens your attention span in terms of what it is that you had to do. Now, the interesting thing is that when you start to do something like this, you see there are benefits and byproducts to other programs. When a prisoner makes up their mind that they want to be a better father, they're going to be a better student in the AOD program that we're delivering. Absent that commitment, AOD program simply gives information. So if you want outcomes, you've got to make that cognitive shift. So here's an opportunity where doing something in the family area helps them. Again, we were asked to keep under the contract a library. We wanted to produce a resource center. We wanted to mimic the sorts of things that they can have outside when they go into the community. So this could be, for instance, whilst they can't have access to World Wide Web, we mimicked in computers an internet experience for them, so they could go in and pick up a newspaper and actually try to apply for a job. Trevor and his team have got these themed events that the prisoners can go in and access. We've got, in Cultural Centre, that was a very important focus for us. Many of the prisoners that we have were born in Australia, but they came from very diverse cultural backgrounds. Their parents still were steeped in the old culture. So they were kind of in a no man's land. And what we wanted to do here was to give them the opportunity to reconnect with their culture, but not in an exclusionary sense, but they wanted to actually bring it inclusively. So what they did was that for example, the most recent one, I think, was a Polynesian event that took place. Staff and prisoners of all backgrounds and all cultures actually put together a Polynesian event. In fact, the ceremony was commenced by an Aboriginal elder. One moving story there was that we also invite families to visit these events. There was a mother of, I think, a sort of 20-year-old prisoner, came all the way from New Zealand to see him perform. Now here's the point. She said afterwards, that's the first time I have seen him perform. I didn't know that he could do that. Now just imagine what that would have been like for the prisoner. That particular prisoner wants to go out, certainly doesn't want to come back, but he wants to work with other youth who had similar background to make sure that they don't come into prison. So that's the kind of change that can take place. These are small programs. We've got education program. Most of the prisoners have had very poor schooling, so they have a very antipathy towards TAFE program. First, we wanted to do TAFE programs because we want to have portable qualifications for the prisoners. But then we found that they don't want to take that up because they were scared by it. So now Trevor and his team have come up with a Taste of TAFE program. It's a 12-week program where they can go in and pick and choose different courses and get the idea of what a TAFE course is like. Then we've had resettlement. Now resettlement, all of you know, of course, that's a crucial part. It's not just about training them for a job. We wanted to get them a job. So when they Because remember, our remit stopped the prison gates. So when they walk out from us, we wanted them to have a job, if we can. Now, it's not just getting them a job when they leave, but it's also teaching them to keep the job. That's not easy. That doesn't come naturally to people. So Trevor and his team again had to focus on that particular program about how, I think, what do you call it? What skill was that? Generic skill, was it? Yeah, generic skills. Then in health. Now, most of the prisoners who come there, you know the prisoner health, high-risk population, multiple morbidities. Most of them don't even know how to access health services. There was one case, one of the nurses told me, was not in one of the prisons that we're on. We also provide primary health for public prisons as well. In one of the public prisons, a particular prisoner, as they call it, was caving. That is to say, he sort of started staying in his cell and not coming out. The correctional officers went there, asked him something. He didn't come back. He didn't complain. When our nurse went there, saw him, found out that he'd broken his ankle. He was playing and he broke his ankle. But he didn't know how to access help for that. So when he saw the correctional officer come in, he pulled his finger out and said, can you send the lady to take my blood? Because the only contact he has had with health people was when they came to take his blood to test his blood. So he thought that's what they did. That's what it feels like to go and see a doctor. So for those sort of people, we have to teach them how to access healthcare. So one of the programs that Juni people did was, of course, just simple things like, how to keep to a diet. I think about 80% of the people signed up for it. I think 90% of those reduced weight, and something like 70% reduced their cholesterol levels. Now, this might seem like normal things for us, but this is what happens in prison. Then we've got settling back them into the community. Now, with that one, we partnered with Habitat for Humanity. In June, the council provided us with a piece of land. The prisoners built a house. So in the process, the prisoners who were involved in it got a trade qualification through TAFE. The house was literally, went over the wall of the prison, got plonked on the land. Council, I think, selects a needy family, and they get to have the house at nominal interest rates. Now, there, the issue for us is about what it makes the prisoner feel who's participating in that. One, they get a qualification, yes, but they also reconnect to the community. So when we talked about GEO Builds a Better Life, with all the providers in this space, if you're going to produce outcomes, it's about getting the mission statement sharper. I know it's good to have inspiring statements, but it also got to be executable. So your staff can prosecute them and bring about these results. The other one is to encourage the frontline staff to do these sorts of things. It costs money, and you have to take a risk, but this is where, in a private sector, the time it takes us to approve that is very short. We meet as an executive, we decide when an investment proposal comes in, whether it works or not, that's it. There is no ponderous evaluations that take place. And that's an important lesson to learn, because if these things are going to come up, both sides have to learn how to speed things up, both the providers and the government sector. Otherwise, we're going to be still talking about pilots 5 years from now. And that's not the space we want to be in, obviously. Finally, I want to give you some quick run through of 3 programs, just to give you a sort of taste of what happens there. The first one is an Exit 180 program. The program was named by the prisoners. Exit 180 is that they come out of prison, look at the prison one last time, turn around, turn their back, and go away, don't come back. Now, the first bar that you see there is the state prison populations return to corrective services, over 40%. That is people coming back, not just to prison, but also community corrections. Then you've got the state return to prison, which is also about 40%. The people who went to Exit 180 program, it was just over 30%. Now that was a significant drop. Then we started analyzing those figures, and what we found was there were quite a few parole violators in there. If you then take out of that group, the people who actually committed new offense, 6%. So then that got the staff to think, well, if the parole violators are coming in, what are these? And quite a lot of the time it's technical violations. A prisoner goes back, stays with his girlfriend, has a fight, moves out, and stays with his mum or his brother, well, he should have notified the parole people. And if he doesn't, that's a parole violation. So what Trevor and his team did then was, of course, try to teach these prisoners about parole violations. You show them that bar graph and say to them, you do that and you come back to prison. It's a mind shift that takes place. And then it's about teaching them the skills and the knowledge of what they have to do when they get out into the community to stop coming back. Now Challenge Community, similar sort of thing. It's in Victoria. It's a small young youth offender program. This is a therapeutic program, but also an adventure challenge. The state average was over 40%. If you now jump to the third bar, which, that one there, the number was just under 30%. If you then look at just in Nalu, it was just over 20%. But if you pick up out of that, the high-risk group, these are the people who are assessed as being high risk of coming back into prison, the control group said over 40%. The Nalu, high risk, was just over 20%. So the program for which, the target group that for which that we designed the program did very well. The last one, observation numbers, this is in, at Arthur Gurrick. One of the problems with the remand centre, of course, is that people come in, the first time they're coming into prison in some cases, many of them are on antipsychotic drugs. So it's a high risk of suicide and self-harm. Now, of course, we've got processes to manage that. The problem, of course, is that it's about trying to detect that early. Of course, once we know somebody is about to self-harm, we can put the interventions in and stop that happening. But the problem is that a lot of the time the damage is done before anybody notices it. So the team came up with the idea that we should have a mental health first aid training to staff and to prisoners. And so prisoners find their fellow prisoners not traveling so well, and they started identifying that for us. Again, the observation numbers, that is to say the people who had to be treated, went down dramatically. The last slide now. So where to from now? Well, certainly paying for performance. There are lots of concerns. These sort of conferences are essential because they bring those concerns out onto the fore, and then we can deal with them and get it sorted out. The importance of partnerships, very important. If we want to get outcome-based programs, we must remember that the target groups require a village to get that right. So there's got to be collaboration. And this is just economic theory anyway, but I'm not so sure this sort of pay for performance works for core services, but this is a debate that had to be had, and I haven't got time to go into that. Expertise in negotiating pay for performance contracts, that also has to be improved. So again, this sort of conferences will start perhaps hopefully help us, because we don't want to have that sort of thing taking too long in the process before things come to fruition. A transparent succession measures, of course, that is important. Independent assurance of performance might be an issue because, it's all very well to have these performance-based contracts, but there are going to be disputes down the track because there's going to be arguments. As I think somebody raised the point about, what happens if the social policy changes and as a result, the national recidivism rate either comes down or goes up. What are the impacts on that? Another one might be that if something works, it's like a medical trial. If something works, you keep that away from other prisoners, other groups. You might have to provide that same successful intervention. Now, if you did that, then the average comes down for the nation, but then that might impact against your program results. These are some of the issues that we have to come across. Innovation means, of course, accepting failures. Because if you're going to have innovation, there's going to be things that are going to fail. That means that those that succeed must pay for the ones that fail as well. Of course, the take-up by capital markets, we've talked about that. And I think from a provider's perspective, all we can say is it's time now, get on with it. We'll have to get on with it because this sort of pilot projects taking too long probably is not the right way to go. We really want to get past the pilot projects and get on with actually delivering the program. If we can move towards that and these sort of conferences can help that, that would be fantastic. Thank you very much.